Hey, let's talk about a little bit about the reproductive system. Let's just know that right away, a man implies sex. Yeah, okay, let's go. A woman, when you mention sex to her, it's, is it that time of the month? Did I shave my legs? How's my armpit smell? Do I have perfume on? What does the bed look like? So it's a lot more for a woman than a man regarding the fact of accepting having sex with a man. So today when we talk, we'll be able to understand a little bit more why that occurs. Okay? All right. First of all, the reproductive system is one of the most unique one that we deal with in anatomy and physiology. Why? Because it is the only system that does not appear or become functioning until puberty. Every other system, respiratory, cardiovascular, endocrine, okay, they all show up from birth. Okay, so this is the only system that takes time for it to actually show up and be used. Primary sex organs are also called gonads. They're the testes in the male, and in the female they'll be called the ovaries. Okay. The gonads are going to produce sex cells or gametes and secrete a variety of steroid hormones called sex hormones. The remaining reproductive structures, ducts, glands, external genitalia, those are referred to as the accessory reproductive organs. Okay, women have it as well. Let's start with the men. Okay. All right. The reproductive system itself, the organs are going to be grouped by function. Gonads, which are the testes and ovaries, which are going to produce the gametes and hormones needed for anything to occur properly. The ducts, those are important to receive, store, and accept more gametes. The accessory sex organs support the function of the gametes. It helps out what they're supposed to be doing. Supporting structures, reproductive structures that help ultimately produce offspring. Okay, so that's the main goal, obviously, of the whole reproductive system. Male and females are equals within reproductive systems until fertilization occurs. Men will try to argue with me on this, but no. Okay, so after fertilization occurs, only females are in control of the system by supporting, fertilizing, and growing the offspring, the fertilized egg. Sex hormones are androgens in the males, estrogens and progesterone in the females. Okay, all of those that I've just mentioned, whether they're in males or females, they're going to play a vital role in the development and function of reproductive organs, sexual drives, both in males and females. It also has an effect on behaviors in males and females. Example, menstrual cycle, females tend to be more emotional than normal. Okay. Men, when there is a higher dose of testosterone in a male's body, they tend to be more aggressive. Okay? Again, that just demonstrates their drives and behaviors. Males traditionally think of only a few things: when they're going to eat, when they're going to sleep, and when they're going to have sex. And how to accomplish any of those three is the extras that are in the male's brain. Okay? Yeah, I pick on you men, you know, it's great. Let's talk about the anatomy of the male reproductive system. Sperm-producing testes that we saw in both lab and lecture lie within the scrotum, that's the outside skin of the testes. From the testes, the sperm are delivered to the body's exterior through a system of ducts. Things that I've told you, you must memorize in lab in order to pass. Okay, so we're talking about the seminiferous tubules, we're talking about the rete testes, epididymis, vas deferens, ejaculatory duct, finally ending in the urethra and out the penis. Okay? The scrotum is a unique thing for, as far as I'm saying, a scrotum is unique. It's a sac of skin. It's superficial fascia that hangs outside the abdominal pelvic cavity at the root of the penis. It has hairs. It's paired oval testes. The midline septum, okay, that divides the scrotum in half is quite visible. This area is highly vulnerable. Just threaten to kick a man and you'll see how vulnerable it really is. Okay, the reason it is in this location is completely brilliant. Sperm can't produce in abundance at our core temperature of 37 degrees Celsius. This superficial location produces a temperature 3 degrees lower. At that 34 degrees Celsius, now it can effectively produce mass amounts of sperm correctly. Okay, so it is also in a constant motion. That 34 degrees Celsius is not always. I mean, if you know a man or you are a man, you could say, okay, yes, I can understand this. Because when it is falling below that temperature outside, let's say it goes down to 32 degrees Celsius, that's not optimum temperature either. So what happens is you've got a cremator muscle, and this cremator muscle pulls the testes closer to the body, therefore warming them up and bringing them back to the natural temperature they need. Okay? Secondly, we all know that the testes can be hot and flaccid and wrinkly and sweaty. Okay? So what happens is when it's still cold, okay, these Darlos muscles are going to cause wrinkles, okay, to the scrotum, again, to deal with effective temperature changes. So there's two muscles that you are required to understand what the purpose of and what they do, and in what circumstances do they do it for your final. Okay? Okay. Your testes, they're a pair of them. I've already said that. They're plum-shaped. Can they vary? Sure, of course they can vary. Not everyone has the same size testes. Maternal hormone levels and Y chromosome determines the size and functionality of your testes. Kind of creepy when you think about it, but it's really interesting. I thought you would like to know that. They develop in your abdomen and they begin their descent at about 7 months. They should be fully descended by puberty. However, does it happen where that doesn't occur? Sure, there's disorders associated with that where the descension hasn't completely occurred, and we'll deal with that shortly. Okay. Two main functions are to produce androgens and sperm. That's their job. Does that mean if one doesn't descend, has to be removed, that you only have one testicle, that you'll be lower in the production of androgen and sperm? Well, yeah. Okay. Two is doing the job right now. If you only have one, where you're going to decrease the amounts. Sure, makes sense. Okay. Okay. Obviously, testes need surrounding protection. Okay. So each of the testes are going to be surrounded by two tunics. Okay. The outermost layer is tunica vaginalis. This is going to be derived from the peritoneum. The deeper serous layer is tunica abogenea, and that represents a fibrous capsule. You were able to see this in lab today when I did the dissection of the bull testicle for you. Okay. Male reproductive system. Okay, you've got the seminiferous tubules. Remember that those are going to be in that testicle, that model. Those are on the outermost ridge. Okay, those are sperm factories. Each are thick stratified epithelial surrounded by a central fluid containing lumen. Okay, they contain the sphenoid spermatogenic cells. Okay. Surrounding each of these seminiferous tubules are 3 to 5 layers of smooth muscle like myoid cells. Their purpose is to contract rhythmically to help squeeze the sperm and fluid and also help with the sperm formation. Okay. All right. The barrier between blood and testes, specifically to sperm, prevents a really serious situation from occurring. Here it is. You were born, yes, with reproductive system, but it didn't become known until puberty. All other systems, including your blood and your white blood cells and your immune, okay, those were shown much earlier. They were developed. They're functioning. So now at puberty, when you're producing sperm, your body, lymphatic system, has never seen it before. If there wasn't a barrier between the blood and sperm making areas of your testicles, they would naturally attack it as unknown or not self. That's kind of cool. In fact, when there isn't that barrier there, some men have the inability to produce sperm because of this factor here. Okay, I think that's really cool. Okay, you have, special cells that are called Sertoli cells. Those are your supporting cells. Those are going to be bound laterally by basal junctions, kind of like this. Like this. Of course, these are fingers and not cells, but I'm doing it the best I can. So they're bound by basal junctions laterally all the way around. They're going to secrete fluid for movement of sperm. It's also within the secretion is not just for movement, it's for nutrients. They're alive. They have to receive nutrients to continue surviving and be viable. They do respond to hormones. Okay. That stuff's pretty interesting. Okay. The male sperm, a spermatozoa, you're producing about 300 million a day to become matured. And again, yes, that varies. That's why some people can get females pregnant a lot easier than others and have difficulty about it. So about 2 days after ejaculation, they die. Okay. The structure, they have the head, the midpiece, the flagella, which is the motion, that's their tail. The midpiece is really important. It's going to be the site for ATP production. And the head is going to contain the nuclear material necessary to help with passing on your information to a female. Okay. Almost done. The development of male reproductive system begins in the womb. Testosterone forms the duct system very effectively. DHT, dihydrotestosterone, affects your size, shape, and effectiveness of your external genitalia. Estrogens from testes are associated with brain development and coordination between the two. Okay. Puberty, that's going to be with the testosterone, DHT. That's also going to stimulate the enlargement of your gonads, organs, and secondary sex characteristics to be ready. So let's talk of those secondary sex characteristics. Testosterone, that's going to give you muscle growth, so it'll become a lot larger than normally would depending on the age, and it's becoming a lot earlier. It used to be puberty wasn't happening until, I don't know, 15, 16. And now I'm seeing secondary sex characteristics on my children whom are 8. So it's beginning much early, which scares me. Okay, you're going to have hair growing. You're going to have epiphyseal closure on your growth plates. Oil gland secretion, oil gland secretion, meaning you're starting to stink. You get kind of sweaty, it smells bad. You need a deodorant. That's a sign that you're going into this puberty state. Larynx enlarges, your voice is going to begin to change. On males, it's real obvious. Male behavior, it's going to change. You're going to become more aggressive. This is when they're starting to get into little fights or arguments at school that you notice. Spermatogenesis begins. That means they're actually making your sperm. Sex drive in both males and females increases with the testosterone. That's just demonstrating that you find an attractive girl and you pay more attention than you used to. Okay. Metabolism changes, and we'll talk about anabolic steroids or the abuse of this testosterone. Okay. Ducts. Ducts, again, like I've spoken about, offer a network of safe passage for sperm to move. Spermatogenesis tubes are straight tubules, rettae testes, and epididymis. It must be a constant, continuous sperm and testicular fluid production and movement. The fluid must contain water, hormones, potassium, acids to help alter the pH. Okay, I'm going to end this here because it's a nice place to stop as far as saying part 1, and I'll see you again soon.